jaundice. How do we know that the jaundice is physiological, that is not pathological? Usually, that type of jaundice occurs on the third or the fourth day of delivery. But you see, some women will see, the moment you deliver the baby, they will come and tell you, doctor, check if jaundice. In fact, if you see jaundice on that day of delivery, that jaundice is pathological. It's not a physiological jaundice. For a jaundice to be physiological, that means a normal jaundice. At least we should give some time for the baby to have breathed in air, then destroy the red blood cell before it will now appear in the eye, on the skin. So, if the jaundice develop 3 days or 4 days after delivery, it may be physiological jaundice. But if it develop on the same day of delivery, you just deliver a baby today and you see that the baby have jaundice, that means there is an intrauterine infection, or there is what we call mild form of erythroblastosis fetalis. What usually causes that one is ABO blood incompatibility. I mean, the woman is rhesus negative and the husband is rhesus positive. They born the first one and there is a cross reaction on the second baby. That can give you intrauterine jaundice. But jaundice usually, once it occurs on the third day or the fourth day of birth, usually you see that time when the baby come for circumcision on the 8th day or so. That jaundice, sometimes what it needs is phototherapy. There's a type of machine where you keep the baby, which simulates sunlight. While you cover the essential organ, cover the eye, and cover the penis if it's a boy, then expose this child to ultraviolet radiation. It clears it. It doesn't need grape water. It doesn't need phenobab. It doesn't need any treatment. Why doesn't it need treatment? Because it is a physiological jaundice. It's a normal jaundice. After some time, some of those jaundice will go. I don't know if you understand. But another form of jaundice is a pathological jaundice. That one is caused by infection. If the jaundice arises immediately when you deliver the baby, that means there is an intrauterine infection. That is when you start giving the child antibiotics or whatever, before it will cause kernicterus, which is one of the complications of long-standing jaundice in the children. So whenever we come as physician and you realize that this child actually has a jaundice, the first thing you will do, the first thing we are going to do is to actually find out, is this jaundice physiological or pathological? It depends on the timing. Do you understand what I'm saying? In as long as it's good for a woman to have menses, at 12, 13 years, a little girl came and tell you, auntie, blood is coming out.